been living so long with eye pictures of you that I almost believe that the pictures are all I can feel. Oh man, I have not slept well at all the last 3 nights. Is there something in the air? Because I feel like there's consistency in reporting of this from other people. So, shower thoughts this morning. Rather not shower thoughts, shower recollections, and nothing weird here. I was thinking about my conversation with a man who I met last week. Dr. Jeremy Feldman, who is the Michael Jordan of lung diseases and scleroderma. He's one of them. And he was a really sweet guy. I could tell he really loves his craft and cares about what he does. And he said something to the effect of, don't quote me, you know, when I asked him, hi, how are you? I'm Billy. What you do? Why do you do it? He says, my interest is the intersection between lung diseases and connective tissue disease. And I was like, wow, this guy's a total geek. And he's using words like phenotype and expression, and he reminded me a lot of my physiology teacher. His pants were probably pulled up above his belly button and he was wearing a plaid shirt, and whenever the enzyme phosphodiesterase would come up, he would joke about erectile dysfunction drugs. So pretty cool guy. And we vibed right away. We talked about briefly 2 things, and the first was the tragedy of the fibromyalgia patients out there, okay? My sense is he overestimates, and this is probably where we would have a disagreement. I'd have to talk to him more. Maybe I'll get him on Instagram, we'll see. My sense is he has an overestimation of primary fibromyalgia and gives too much credence to what some of these rheumatologists say. And what I mean by that is you go in, you get a 5-minute fibromyalgia diagnosis and nothing else is going on. My sense of it is there's much more secondary fibromyalgia, and fibromyalgia tends to be a symptom rather than a standalone of something bigger going on, which is hard to wrap your head around. How could something like that be a symptom? Widespread pain, irritable bowel, sleep disturbance, dysmenorrhea, yada, yada, yada. But anyway, what we were talking about was the fact that fibromyalgia patients end up on a cocktail of drugs that do them no good. They may help in the short to medium term, but in the long term, they destroy you. They wreck your they wreck your brain and put you in pain. That rhymes. They put you in more pain in the long run by virtue of weight gain, by virtue of enhancing central sensitization. So these are your things like your muscle relaxers, baclofen, cyclobenzaprine. Is baclofen cyclobenzaprine? Or is that Flexerol? I can't remember in this moment. Gabapentin, Lyrica, these gabapentinoids, narcotics. I mean, I don't totally hate Lyrica or write that one off, and you can get crafty with it, and sometimes I'll dose it differently. But yeah, these folks get a 5-minute fibromyalgia diagnosis. Sometimes they're told their SED rate or CRP is up because they're overweight, and then they're punted off to pain management, which is one of the worst things that could happen to them. And they're started on all these drugs, and so, you know, he says that's piss poor practice, and he often is slowly peeling these medications off of these people's repertoire. So that's fine and dandy. I like that. The other thing that was really cool, where we really vibed, was acting before we have precise specification of what the ICD-10 code or diagnostic label is. In medicine, there's a lack of balance across providers, both on the side of the Jedis and both on the side of the Sith Lords. Depending on your philosophies and your perspective, the Sith Lords may be the naturopaths, the Sith Lords may be the MDs and the DOs. I think there's evil on both sides, but there's extremes and there's imbalance. You've got those on the naturopathic, functional, alternative side who say the diagnosis, the ICD-10 code, whether it's lupus, Sjogren's, scleroderma, Hashimoto's, this or that, they seem to care more, by the way, these alternative providers, if they see a TPO or a thyroglobulin and can call it Hashimoto's than anything else. And what that should reveal to you is, quite frankly, that's really all they're comfortable and familiar with defining. But everything else, the diagnosis doesn't matter because we're just going to remove obstacles to health, give your body what it needs. I'm going to put you through this $10,000 program and you'll be right as rain. Haha. And then you have the MDs, the DOs on the other side who say, evidence-based medicine, we're not going to act until you fit classification criteria. Well, shoot, in some cases by then, when it's very obvious in your textbook, by the way, diseases don't read textbooks. By the time you get to that point, if you ever get to that point, the disease has progressed for some time and you're much, much harder to treat, and we need to commit you to heavier duty drugs that are more expensive and have more significant side effects, okay? And so it was refreshing to have a conversation with Dr. Feldman and reassuring to me, because I'm like, wow, I'm not the only one who thinks this way. I'm not crazy. Perhaps I'm not over-treating. And I was having a conversation with a colleague about this. What are the consequences of starting a disease-modifying agent, trying a little steroid, or God forbid, things are really nasty in the beginning and you have to go the biologic route? What are the consequences of trying a medication, removing the medication, versus the consequences of not doing anything because you don't read the textbook or it's not obvious what the disease is, and we wait 1, 2, 5, 7 years until the disease is very clear and obvious to diagnose? I gander that they're very different. And so it was really interesting to hear Dr. Feldman talk about his experience in the clinic and with investigators doing studies for some of these really nasty variants of connective tissue disease that affect the lungs, and how some of his colleagues were losing their marbles because, they're talking about getting these anti-fibrotics like, I can never say the drug name, nintedanib. I just call it Nintendo because I'm not sure if I ever pronounce it right. And, I'm a child of the 90s and Nintendo. Getting these drugs on board before we have precise specification of what's going on. That fibrosing disease, it could be rheumatoid, it could be scleroderma, it could be lupus, it could be this, it could be that. But these lung changes are happening, and if we don't do something right away, you're not getting that lung function back, you're not getting that lung tissue back. And so, he's talking about getting the ball rolling, and some of these providers are shitting their pants and losing their marbles because it's like, we don't know what it is, oh my God, we can't do this. So anyway, fully on board with getting medication going if necessary, despite lack of precise specification of what the autoimmune disease, right? He used the terms splitting and lumping. There's a time and place for splitting, there's a time and place for lumping. We got to use our best educated guess sometimes and just lump, depending on how the disease is manifesting. And, that may also mean elimination dieting, treating the gut, hormone modulation, chronic infections, toxicants, obviously. Not just a one-sided approach, but really sweet guy. What I really wanted to ask was, hey, Dr. Feldman, what are the consequences of this? And I wanted to see if there would be any jab within him seeing a naturopath who vapes. But I would imagine, we were talking about pulmonary arterial hypertension, that he would say something to the effect of, maybe not saying anything, but wagging his finger, shaking his head. Okay, it's, what's today, Tuesday? Yes, I'm adjusting my seatbelt for those of you that care, thank you. It's Tuesday. Everybody have a happy Tuesday. Be safe. Hopefully I sleep better tonight. Okay, bye. Ooh, pour some sugar on me. Def Leppard.